that have ensued in the discussions or even the solutions that have been brought forth on COVID-19 have been quite experientially collateral, in the sense that those who cannot, the uncertainty, for instance, the nominal epidemiological and medical expertise, or some expertise that have been attended to thinking around medical interventions, have to a large extent not even considered the existential knowledge, endogenous knowledge systems that scholars such as Odora Hoppers said are quite important to interface with the new or the natural sciences and interventions that epidemiology or vaccines have proffered. But also important is the fact that we in South Africa, but also other African countries, have sought to look for money from international financing institutions in order to obviate the challenges that COVID-19 has exposed for society, especially in the economic arena. The challenge, however, has been that we have capitulated to the machinations of the global economic systems and its sometimes unintended consequences that plunge citizens and women into indebtedness, where the ideological artilleries of death and where the rehashing of the ideological artilleries of death are occasioned and continue to manifest. What does this mean? When the new World Trade Organization CEO asserted that the vaccines must be distributed in order to ensure that they are accessible, the profiteers were not comfortable with this, and instead of acknowledging her talent, described her in an ageist manner that challenged her idea of an inclusive economic intervention that has global regard for these challenges, understanding the vaccination distribution as an important lever for us to taking into cognizance. But it is also important for us to then note that in spite of the fact that the promises were made, including by the International Monetary Fund, that the loans that would be given or granted would not exact into the micro and financial systems of countries, we have realized that the political grammar of the custodians of fiscal policy and economics at a local and global levels have tended to suggest that there are no compromises on the sovereignty of countries in the loans that have been asked for in order to mitigate the challenges that COVID-19 has exacted on society. The truth and the lessons that we have garnered are that the elites of our countries, and not the women, not the marginalized poor in our countries, are the ones who have suffered the wrath of these investments, which should have actually obviated the life-denying milieu of apartheid-like or colonial-like arrangements which never took into consideration and which dehumanized the dignity of humanity and negated their living. And I want to take, for instance, the poem that Kiurapetse Khutsitsile shared with us in the Wounded Dreams, where he says, though the present remains a dangerous place to live, cynicism would be a reckless luxury, toxic lies pulled high and deodorized to sound like the most clear signage, showing us the way forward from here. And he continues to say, though the present is a dangerous place to move, the place to live possibly remains what moves us. We are all involved. Indifference would simply be evidence of the will to die or trying to straddle some fence that no one has ever seen. For me, the invitation by this poet and poem is that we must take cognizance of the feminist call for gender budgeting that responds to the questions of economic access, distribution that gives dignity to the lives of women and men in society and prioritizes the imperative for enhancing and supporting women. For it is also in changing policy systems like this that we will assert and change the patriarchal, hierarchical economic infrastructures and architectures that strip out women of their dignity, but also of their moral agency to overcome the challenges that they face. It would mean to me that as we imagine the 2021 and beyond futures, that we should be willing to co-create in a gendered way Africa of futures that primarily draw on our philosophies and ensure that issues of dignity, whether in politics, economics, and social arrangements, are important, and that gender justice becomes an imperative. We do not only need to draw on our own experiences of struggles for asserting the dignity of all humanity as important imperatives, but we must try to ensure that our own knowledge systems, technologies, and arrangements that enable us to put in terms the systems that involve women and men in the rethinking and reimagination of the future becomes an important arena. Scholars refer to thought systems such as those as the decolonization of thinking from the logics of conquest, of profit, motive only, but of distribution systems that allow people at all times to engage in the progressive and constructive determination of how they live and construct their futures. And therefore, we must be countercultural to mimicking the oppressive, economically unjust systems that COVID has sometimes exposed in terms of the global trade agreements, arrangements, but also the family and work relationships. We must ensure that the unjust systems are collapsed in the ways that feminist scholars such as McFadden, Odora Hopers, Pumla Kola raise, precisely because we cannot squabble around whether dignity is important for women, but we can squabble around how we ensure that is manifest at micro, meso, and structural levels. In particular, I want to reassert, drawing from Pumla's work on rape, where she gives a cogent argument that when we snuffle out life out of women and their communities or those on the margins through cultural systems of rape, we are definitely creating fatal conditions that deny the dignity of women to flourish, but also that deny communities where women are integral to their thinking are central. We must rethink, we must reimagine and construct economic systems of futures that take into consideration these ideals of human rights, of economic justice, of gender justice, of awareness of gender non-conforming individuals and their assertion for the quest for dignity in our world. As an African intellectual and feminist scholar, it is my commitment as well to stating that the future that we should imagine must not only be limited to medicalized interventions that are separate from the quest for dignity as we shape and allow ourselves to participating in shaping the future. In particular, this requires that we invest in educational systems that will extricate women from cycles of continued poverty, but also their communities. It would mean that policies that deal with higher education, with basic education, with agriculture, and other related systems must take into cognizance the imperative to move into a future, for we are not interested or committed to building a future that continues to push us in the margins, but a future where we dialogically and intricately in the theorization or the praxis of such futures participate meaningfully and fully. I think if we don't take advantage of the spirit of advocacy that is already at hand around gender budgeting systems, we will actually lose out on constructive futures. For the non-attention in the fiscal and financial or monetary planning of our systems, which do not take into cognizance these ideas that women tend to bear and be the faces of poverty in our society, will actually mean nothing. To get to my conclusion, I'd like to reassert that if the responses to the COVID-19 are to be effective and not just another talk, we should ensure that we do not reproduce or perpetuate the gender inequities that we are accustomed to. We must create effective systems that do not only attend to the gender norms, roles, relationships, or agency of women and men, but we should take these lived experiences as guidelines for ensuring that we change, not transform our society for the better. The future requires a formulation of socio-economic plans that have an intentional focus on the lives and future of women and men, not only taking the economic systems into consideration, but also taking into consideration the economic, ecological, climatic changes that are constantly becoming threats for the future, which are extended by the COVID-19 and its intended or non-intended consequences. In this regard, we must ensure that the socio-economic plans are entwined with the ecological plans to ensuring that sustainability becomes central to thinking futures. For as we imagine a future where the economy, ecology, and justice are intersected, we will therefore create systems which are not only fit for the reality of workers or for women, but will be fit for the realities of all humanity and citizens and the next generations, which must benefit from the decisions that we take at the present. We must also ensure that the resilience of our grandmothers or forebears, which navigated patriarchy as African royalties who marched to the union buildings and thus made a gendered bodily resistance to the systems of past laws, who juggled the roles of being both fathers and mothers on account of a cruel migrant labor system, who were able to hold their own in the world of men, will teach us and has taught us, or will continue to teach us as women folk, as gendered beings, to have a sense of agency that allows our voices never to being muted, even when our wellness and well-being are challenged by COVID-19. The recovery for COVID-19 in the aftermath of this pandemic must therefore ensure, as Phumzile Mlambo-Ngcuka rightly asserted, that we must not rebuild the old world, but make women and girls central to the plans that bring a better future. The point here is that we should not strive to return to what we did, the so-called normal, but we must embrace COVID-19 pandemic as an opportunity to reimagine a different future. We must, in a profound words of our forebears, ensure that we change the situation, even the context of structural challenges, not relenting to the current dangerous place. For as we rightly asserted, we cannot be cynical or recklessly indifferent to the challenges that COVID-19 imposes for us as humanity, but also particularly for us as women, but also those who are on the margins of the economy, ecology, and justice. For the present must influence the future, and we must ensure that as we move into the future, that we take cognizance that gender is not just about the distinct biological differences, but it is the invitation to ensuring that dignity is manifest for all humanity and all citizens. Thank you.
Thank you very much, Professor Lenka Bula, for that insightful intervention and keynote this afternoon. I will immediately go on to our panelists. And the first panelist to speak this afternoon is Dr. Jomo Kwame Sundaram, who has been the Assistant Secretary General for Economic Development in the United Nations Department of Economic and Social Affairs in 2005. There's a lot for me to say about Dr. Sundaram, but I'm not going to go into that now. We don't have the time for that. I will immediately ask you, Jomo, to go into your intervention that will look at the gendered perspective on relief, recovery, reform. So over to you. Thank you.
Thank you very much for your kind invitation to join you on this auspicious occasion, and also to discuss a very challenging subject. I want to particularly thank the Mbeki Foundation for organizing this event and also for inviting me. And I also want to congratulate Professor Bula on her recent appointment at UNISA. Allow me, especially since we are constrained for time, to try to make a few points. It's very difficult because Professor Bula has covered much of the landscape, including much of what I would have liked to say. But I think it's important for us in looking at the situation in which we live today to consider the opportunities as well as the pitfalls of the present moment. I think it's important for us to recognize that before COVID-19, that there had been a bit of progress. More girls are attending school. We also find that there are fewer women, for example, dying in childbirth, and fewer children, infants who are dying in childbirth. And we also find that there has been, at least in the last decade, over 130 countries in the world which have introduced legislation for gender equality. So all this has been progress. It is too slow, and it has been very, very uneven across the world. The new dispensation in South Africa basically opened up a lot of opportunities, and precisely because it was such an unequal society, there was perhaps greater appreciation in South Africa than in much of the rest of the world about the need to reduce inequalities, including gender inequalities. But what we see now with the pandemic, with COVID-19 impact, is that much of the very modest progress which has been achieved so far has actually been set back. And what we also find is that the pandemic has been worsening many of the other pre-existing inequalities which we find in the world, gender inequality being part of that, but also many other inequalities. And it's important for us to recognize that much of the gains of the recent period, for example, have also been set back, if not actually reversed. So we are living in a very, very challenging times. I know that's very common thing to say, but I think it is particularly important to recognize that women are especially in the forefront. In many of the frontline health workers, for example, are women. In most societies of the world, we find that a majority of frontline workers are women. So the inability, for instance, to get sufficient protective equipment for the frontline workers is an issue which has gender implications, undoubtedly. And perhaps we can even say that part of the reason why it is not being taken seriously, particularly by some in the rich countries, is precisely because of this. So we find, for example, that there have been quite a number of important setbacks, and that women are also especially burdened now because, as we all know, there is the disproportionate burden of care work, both commercial care work as well as unpaid care work in the household is borne by women and girls. So all this becomes a very, very major challenge to us. But also, it's precisely because we are living in these conditions that we have the opportunity to recognize this much more, and the ability, therefore, to begin to change. And this, I think, is part of the opportunity which we have today, and why we need to seize this opportunity. I think it is also important to recognize that South Africa, for various reasons, has had a very, very high burden in terms of the spread of the disease. And despite the various lockdowns and other measures which have been taken. And I think it's very important for us to recognize that lockdowns, stay-in-shelter lockdowns, are not the only way to try to contain the contagion. If we look, for example, at East Asian countries, East Asian countries have generally done quite well, and almost none of them actually have had stay-in-shelter lockdowns, except on a very, very localized basis. And this, for example, when the world was struggling to understand this new phenomenon of COVID-19, we find that in China, particularly in Wuhan city, where the pandemic first began and spread for at least a month until the end of January last year, that we see that there was a concerted response by the Chinese government. Stay-in-shelter lockdowns were temporarily imposed, not only in Wuhan city, but also in the 3 surrounding provinces, because many of the people who worked in Wuhan city, which has long been the industrial hub of China, actually commuted from the 3 surrounding provinces. So you had millions of people commuting every day to work in Wuhan city who were coming from the 3 surrounding provinces. Infections spread to the 3 surrounding provinces, of course, and hence it was necessary to have those stay-in-shelter lockdowns in those places. But except for that, and in the rest of China, you did not have stay-in-shelter lockdowns. In fact, in the rest of China, as well as the rest of East Asia, in Japan, in the Republic of Korea, South Korea, in the Taiwan province of China, even in poorer countries such as Vietnam, in Laos, or in southwest Indian state of Kerala, we find that stay-in-shelter lockdowns were avoided. And this meant for instance, that these economies, some of these economies have actually been growing continued to grow during the course of 2020. And this, of course, affects the welfare and the well-being of the workers and others who earn their living in these societies. So what we find is that stay-in-shelter lockdowns have actually been the result of not looking east, but rather looking west. Because it is in the West, both in the US and the UK, which are very, very influential for South Africa and for my own Malaysia, that we find that by looking west, we took a very nonchalant attitude initially, and by the time the pandemic was recognized as a major threat, it was too late, and it became necessary to take much more extreme measures. But this has meant that there has been much more disruption. There has been much more many other problems as well. And part of the problem, of course, is that we do not have enough. We do not have a prioritization on the basis of need in the world, but rather on the basis of money. He who has the money is able to call the shots, able to get the equipment, able to get the medication, able to get the tests, able to get the protective equipment, and now to get the vaccine. So the result is that the burden on society has been far greater precisely because of the way in which governments and societies have responded. I want to emphasize that the job and income losses which have taken place were not a necessary consequence precisely for this reason, but rather it is very important for us to recognize that these were unfortunately imposed on us because of the responses which unfortunately governments took. I also want to emphasize that in those East Asian countries as well as in Kerala, you had an all-of-government approach. In other words, it was not just left to the whole health authorities or home affairs to deal with these problems, but rather you had a very much more integrated approach. And so you began to realize that, for example, in Korea, they began to realize that it was not necessary for everybody to begin work at 8:30 in the morning. You could stagger work hours. You could begin work hours differently. You could have women having shorter work days, especially when the children need particular attention and so on and so forth. And so you had a great deal of experimentation, which much of this has been seen initially as responses to this crisis. But it's important for us to recognize, as Professor Bula emphasized earlier, that we now have the beginnings of a recognition that we can organize society very, very differently. Likewise, in households, it has become much more common for much of the household work to be shared, not only across genders, but even generationally. So all this have been very, very important lessons for all of us, which are very important for us to recognize. Now, when we look at the world of work, we all know that the world of work, to differing degrees and in different ways, has been is gender segmented. But it's also important for us to recognize that the pandemic has had very, very different consequences as far as the impact on work, on the world of work is concerned. Part of it, of course, depends on the nature of work in our societies, and our societies are, of course, very, very different types of societies and has been affected differently, but also public policy responses, not only at the national level, but also sometimes at the municipal level or the regional, sub-regional level. All these have been extremely important. One other important aspect which has been emphasized as well is the impact on what we call the care economy. And I think it's very important for us to recognize that there is paid care work, recognized paid care work, and there's a great deal of unpaid care work. And we need to recognize, we need to valorize the unpaid care work, especially because most of it is done by women and girls. And this is very important, that we should not only recognize and value work which is done outside of the household for money and so on and so forth. We should begin to appreciate a lot of the other kinds of work which go on in our society. Now, undoubtedly, in my mind, one of the consequences of this pandemic is that there's going to be far greater scope for care work, for commercialized care work in the future. And this is going to be very, very challenging. There's also going to be greater recognition of the crucial importance of public health. And because women are far more involved in working in public health, it becomes extremely important for us to recognize the kinds of opportunities, but also the risks which are involved in this matter. And another point I want to quickly mention is food supply. Food supply chains have been massively disrupted, partly as when they have involved international supply chains, but sometimes also domestically. Women's role in food production is very uneven. In some African societies, women contribute most of the work on farms these days because men have gone into the towns, into the cities to work. But I think it's very important to recognize that food production can be organized very, very differently. And we need to recognize that this should not be dictated to by the food companies, the agri-food businesses, which stand to make a lot of money from pushing their products, pushing agrochemicals and so on. So the crucial role of food preparation is also another important matter for us to recognize, because again, much of the burden of this in the household falls on women and girls. So in this regard, I think it is important for us to rethink what we traditionally call food security, but also to put greater emphasis on the question of food safety, because so much of our food today is affected by chemicals which are being produced for food, so ostensibly to promote food production. And many of the major initiatives internationally, as far as so-called food security is concerned, has been pushing many of this highly chemicalized food production. And in regards to this, I think it's very important to recognize that during the colonial period and in the post-colonial period, during the apartheid period and the post-apartheid period, to talk about traditional lifestyles and traditional diets is often not that meaningful because they have been so fundamentally transformed. So much so that what our grandfathers ate is very different from what, for instance, was consumed over a century ago. So it's important for us to recognize that most of the diets, most of what we consider to be modern diets, are not very nutritious. And we need to pay far more attention to nutrition, particularly the micronutrient deficiencies, vitamins, minerals, and so on and so forth, as well as the risks many of us are running because of the kinds of foods which we take in excess, which is causes of so-called non-communicable diseases. I have no time to discuss some of the mental health issues which have come up, and I think it's important for us to recognize that much of the reported increase in violence against women during the pandemic period, not only in South Africa, not only in my own country, Malaysia, but apparently in most of the world, is partly due to the new stresses which have been introduced by the new kinds of conditions in which we live and work. So Professor Bula also hinted at the whole question of the financial system and how it constrains our responses. The financial system has become increasingly private over the decades, and it is now blocking both the funding of both relief and recovery measures. And it's very important for us as we go forward to begin to recognize that the financial system is actually dysfunctional in serving the developmental needs. So the last point I want to make, which is very important, I think, is that we have a situation where South Africa provided global leadership about more than a quarter of a century ago, when Madiba raised the whole question of the public health exception to TRIPS, the trade-related intellectual property rights. And now I think South Africans in particular should be proud that at the World Trade Organization, it is the South African delegation which has come up with a proposal to have a waiver for TRIPS, which will allow the vaccines, as well as the PPE, the personal protective equipment, as well as the medication and tests relating to COVID-19 to be waived, so that the developing countries can have much greater and much cheaper access. Because right now, production of vaccines, with the possible exception of Oxford AstraZeneca, have been constrained by the fact that many of these companies refuse to produce much more at much cheaper and more accessible prices for the rest of the world. So we in the developing countries are going to recover much more slowly, and this is going to worsen many of the problems which we've already, Professor Bula and I, have been talking about. So we face a lot of challenges. I think it's very important to recognize the gender dimensions of the challenges, and I do hope and I do appreciate this opportunity to contribute to this discussion. Thank you so much for having me today.
Thank you very much, Dr. Sundaram. I will immediately continue and introduce Zamanzima Mazibuko, who will now make an intervention. I thought that I was... I would simply want to say that she is a scientist. She is quite centrally involved in the knowledge economy as well, and is currently with the Mapungubwe Institute for Strategic Reflections. I will now give you the floor. Thank you.
Thank you. Thank you so much, Program Director. Good afternoon, all. There are many things that can be said about what a post-COVID-19 world should look like, but my contribution will look at just three. The first, research and inclusive evidence-based information being the main driver of decision and policy making, so more bottom-up and less top-down. There are certain decisions that policymakers take with an intention to assist the most vulnerable in society. However, because there was little to no research and consultation done in the process of decision-making, crucial and nuanced elements are not considered. Take, for example, the 350 COVID-19 grants implemented after around 3 million jobs were lost because of the strict lockdown regulations during the early stages of the pandemic in South Africa. While this was intended to support the vulnerable during this difficult period, the criteria for the grant excluded those already receiving other grants. This seems reasonable at the surface level, but dig a little deeper and you realize that poor women who lost their jobs, most likely informal jobs, because women are more likely to work in the informal sector, as previously mentioned. Those women were rendered ineligible to receive the COVID-19 grant because they were already receiving a child support grant, for instance. This intervention assumes that those who receive the child support grant were not reliant directly on their employment or earnings to make a living. Essentially, it took for granted that those who receive grants are not impacted by job losses as they already receive a grant. The result of such a decision is that even though 2/3 of the 3 million that lost their jobs were women, 2/3 of the COVID-19 grants were paid to men. This means that because the majority of people who receive grants are women, this majority was not eligible to receive the social relief grant, thus disadvantaging women when they needed this assistance the most. In other words, poor women who lost their jobs were being disadvantaged because they have children. So in a post-COVID-19 world, we need policymakers to be more in touch with exactly what is happening on the ground, lest they disadvantage the very people they intend to assist. Policy decisions need to be more research-based and nuanced, and not merely a tick box exercise. Strengthened research capacity in policy-making spaces is a necessity. There needs to be an appreciation of how discrimination shapes the immediate needs as well as the long-term interests of women. Women need to be part of these decisions. Women need to be consulted in decision-making processes. In a post-COVID-19 world, taking into account women's concerns and experiences should be an integral part of the design, implementation, monitoring, and evaluation of policies and programs in all political, economic, and societal spheres, so that women benefit equally and inequality is not perpetuated. And this takes me to my second point on the Syndemics approach to disease management. One of the biggest lessons from COVID-19 is that diseases do not occur, spread, or endure in isolation. Context is crucial. Context matters, and therefore context should be at the center of disease management. Generally, underlying structural drivers have rendered certain populations, especially African women, vulnerable to disease. These structural drivers influence both the spread and prevalence of disease, as well as the effectiveness or lack thereof of measures for prevention, reduction, or elimination. The Syndemics model of health puts emphasis on the biosocial complex, which consists of interacting, coexisting, or sequential diseases, and the environment and social factors, especially conditions of social inequality and injustice, that promote and exacerbate the negative effects of disease interaction. These factors tend to interact synergistically in various and consequential ways, having a substantial impact on the health of individuals and whole populations. When COVID-19 first hit South Africa, although it began in affluent areas, it was inevitable that it would reach the townships and spread uncontrollably because of the special planning. This is an example of social and environmental factors exacerbating disease. Furthermore, in the United States, it was reported that Black women and women of color were disproportionately bearing the burden of COVID-19. This is an example of political factors because there was COVID-19 denialism for a while, and it influenced the magnitude of the disease for a particular population. In recent years, the burden of diseases has been worsened by a significant increase in non-communicable diseases, or NCDs. There is thus an increased risk of the interplay of diseases, both communicable and non-communicable, and the impact of this interplay is aggravated by the social, economic, environmental, and political conditions in which a population finds itself. In South Africa, women have higher levels than men of the three comorbidities now strongly associated with those worst affected by COVID-19, namely diabetes, hypertension, and obesity. NCDs are closely linked with poverty. According to the WHO, women in less developed countries are extremely vulnerable to NCDs, which affect them in their so-called productive years. We have seen how women are more vulnerable to COVID-19 infections in South Africa. Stats show that women have the highest rates of infection across all age groups compared to the male counterparts. In Gauteng province, for example, 56% of positive COVID-19 cases are women, but only 50% of the population are women. This gap is largely occurring for women of working age and for the very elderly. One of the reasons is that women are in jobs that have higher contact care and frontline service work, which means they have increased exposure to the virus. Being socially disadvantaged means having less resources to protect oneself and one's family, and increased exposure to risk factors linked to disease. There is an overrepresentation of women in informal employment, and this environment is unlikely to support or enable adherence of COVID-19 regulations. Additionally, the vast majority of nurses and community healthcare workers in South Africa are women, Black women. They are the majority of frontline workers and have an increased risk of contracting COVID-19. Other reasons may range from women being more likely to live in crowded conditions, being more likely to rely on public transport, being more likely to report a poor health status and to live in households with pre-existing conditions. Women are also likely to have are less likely to have access to medical aid and are more likely to rely on public health care services. Women are testing positive at a higher rate than men, and women have a greater social and economic vulnerability, particularly during the lockdowns. Is this something that has been factored into COVID-19 responses? A post-COVID-19 world needs to appreciate disease management differently. The importance of context and nuances needs to be prominent in the management of diseases, as well as for policies on social relief. The syndemic approach will assist in the development of inclusive public health policies, and will improve the probabilities of effective interventions. There would be more targeted ways of responding to diseases and more focused interventions that take into account the multiple burdens faced by women. We would have a more exhaustive understanding of the foundational drivers of disease and equip societies and decision makers for their better prevention and control. And my third and last point, which is an overarching principle that the world should implement, and that is getting women into the mainstream of every facet of society and compensating them for the work they do. This means women's full and effective participation and decision-making in public life, and recognizing the incredible efforts by women and girls around the world in shaping a more equal future. The consistent devaluing of care across countries, including in relation to salaries and social status, has been highlighted by many feminist scholars. It has been argued that studies of the professions, in particular those concerning health workers, have sometimes reproduced the devaluation of women's work. There are calls for women's rights to decision-making in all areas of life, equal pay, equal sharing of unpaid care and domestic work. Many poor women subsidize healthcare systems by carrying the burden of care where health systems fail to plan and allocate proper resources. This puts the poorest and most vulnerable women in a triple jeopardy of excessive unpaid work, marginalization from the economy while staying home to provide care, and increasing household poverty from the cost of chronic disease. Community healthcare workers, which has already been mentioned that it's mostly made up of women, they need to be more formalized, provided with an environment that enables them to work effectively and compensated adequately. In the long term, it would be far more productive to be more proactive about mobilizing resources to build a strong health system than mobilizing in a panic response to a crisis, leaving women to carry this burden with little to no compensation. Ultimately, a post-COVID-19 future is one that is driven by research, inclusive of women in decision-making processes, and compensates women for the work they do. Thank you.
Thank you very much, Zamanzima. I would like to just remind us who was speaking. Zamanzima Mazibuko is senior researcher in the Knowledge Economy and Scientific Advancement faculty at MISTRA. She obtained her Master of Science, Med, in Pharmaceutics cum laude, and has published on nano-enabled drug delivery technologies in amyotrophic lateral sclerosis, and has a pending patent filed with Wits Enterprise for nano-enabled drug delivery. I wanted to come back and make a point of indicating who was speaking, because we are all committed to an approach where no one is invisibilized, and it was correcting the fact that I didn't do an inappropriate introduction in the beginning. There are 9 questions that have been placed by participants.
So all right, that is the commemorative International Women's Day being hosted by the Thabo Mbeki Foundation in partnership with the University of South Africa, coming out of that one. Let's take a short break. I'll bring you